My name is Robert Sanchez, and I am the founder and the president of the Jentosy Project. I always like to describe my life as I've lived in 3 prisons. 1 is poverty, 2 is actual prison, and 3 is the prison of kidney disease. When I turned 18, I was about to be a father, and I was hanging out with a group of guys who I thought might be able to give me the opportunity to make some money. I knew they were selling drugs, and that's something that I always said that I would not get involved in. So at 18, I went away under the Rockefeller drug laws. It was a mandatory minimum. My mere presence in an apartment that had drugs in it. I had trouble justifying why give me 15 years if I've never been incarcerated before. I never committed a crime. I didn't sell any drugs. So I came home after 15 years. I got a job. I ended up getting kidney disease. Black and brown people tend to wait longer on the waiting list and tend to die at a much higher rate. I decided to create the Jentosy Project after the 2 women that saved my life. I had been living on dialysis for 5 years at the time. And my friends kept telling me, why don't you create a Facebook post and put it out into the universe to say, hey, I need a kidney, and I'm hoping that someone would read this and would be willing to save my life. Elizabeth Jentosy was the initial person who decided that she wanted to give me a kidney. When it came down for the transplant, I was called by the doctor and said, Mr. Sanchez, you're gonna get a kidney transplant on December 4th. You need to come in and do an MRI. Then they called me the next day after doing the MRI and said, sorry, but you have cancer in your kidney, and we need to remove the kidney before we can move on. Once that happened, Elizabeth and I no longer matched. I got a call September 2020. We found a match for you. And Elizabeth Jentosy decided to participate in a kidney exchange program, and she's going to give her kidney to someone else, and someone else would give it to you. Some of the solutions in addressing inequity in the medical community is by having a presence there, having the Jentosy Project at every transplant center in the United States. That way, there's a sort of like a watchdog agency there to assist in creating better relationships between the medical community and the patients that they serve. Some of the myths come from a lack of transplantation awareness. If I'm in an accident and I'm hurt and I'm sick and I go to the hospital, they're gonna see that I'm an organ donor, and they're gonna just take my kidney, let me die, and give it to someone else. These things aren't true. It's really a conversation about Black and brown health, and I'm hoping that the Jentosy Project can open that, and we can really start to make changes in our communities.